My name is Dave Cavanaugh. I'm Government Relations Staff for the Committee of 10,000 in Washington, and that is an organization of people with hemophilia. The number 10,000 comes from the number of folks that we lost to AIDS and hepatitis because of the contamination of the U.S. blood supply in the 1980s. We think it's high time the Red Cross stopped treating the fines that have been levied against it as part of this 17-year court order as trivial. They're a huge organization, $2.2 billion in revenue on the blood side, and $21 million in fines they probably consider cost of doing business. Well, we're the cost of doing business, and we don't like threats to our life coming from an organization that famous.
The AFL-CIO stands in solidarity with all Red Cross workers who are fighting for fair labor contracts and working conditions that improve blood supply practices. If Red Cross wants to improve blood safety and their record, they must invest in their workforce. Trying to run blood drives on the cheap is not good for blood safety and not good for ensuring an adequate blood supply. We understand very well how important blood donation is to the health of our nation. That's why the labor movement is consistently one of the most reliable partners in blood collection, regularly asking all labor union members to roll up their sleeves and donate blood at trusted outlets. In some areas of the country, Red Cross has taken mobile truck drivers and trained them as phlebotomists. Some of these workers have told us they're not comfortable being responsible for drawing blood. They don't have the experience or training to provide the best possible response if an urgent medical need arises. Now, I've painted a broad picture for you this morning. Now, let me tell you a few specific examples. In Connecticut, Red Cross is currently trying to eliminate staffing ratios that the union believes provide greater safety, as well as reduce the responsibilities and authority of nurses. Workers report to us that 4 years ago, Red Cross in Connecticut had 30 nurses on staff. Today, it is down to 11. In Michigan and California, Red Cross is attempting to reduce the responsibilities and authority of nurses. In California, Red Cross and other blood banks even received an exemption from state laws that require certification for phlebotomists. In the New Jersey Penn region, the industry has lobbied to eliminate the requirements for nurses on blood drives. We've received reports that 10 years ago, Red Cross had 75 nurses on its blood collection staff. Now they are down to 18. No one should have to worry about the care they receive when they roll up their sleeves to give blood. And no one in need should have to worry that the blood they receive could actually hurt them instead of helping. American Red Cross must do better.